So hello everyone, our next topic is the plaque control. So what is plaque? First of all, all of you should know what is the definition of plaque. It is structured, resilient, yellow, grayish substance that adhere to the intraoral hard surfaces, including removable and fixed restoration. So that is the definition of plaque. Now what do you understand by the plaque control? The plaque control means it is the removal of the microbial plaque and prevention of its accumulation on teeth and adjacent gingival tissues. Now what are the various ways of the plaque control? Various methods we use for the plaque control can be either mechanical method or the chemical method. So mechanical method of plaque control involves the physical removal of plaque from the surface, like brushing your teeth with a toothbrush or using a dental floss to clean between your teeth. On other hand, the chemical method of plaque control involves the use of substance like mouthwash, toothpaste that contains the chemical designed to help control the plaque. So these chemicals can kill the bacteria or inhibit their growth that can reduce the formation of the plaque. So the mechanical methods can be toothbrushing or interdental aids, whereas the chemical methods, they are mouthwash, antibiotics or enzymes. Now let us discuss the mechanical methods first. The first is the toothbrushing. So these are the various histological perspective of toothbrush. Remember it for your entrance exam. Few important points that you have to remember: that the bristle brush toothbrush, it appears in China in 1600, and in 1780 William Eddies of England made the first toothbrush. So remember all these points for exam point of view. Now what are the classification of mechanical plaque control aids? Number 1, you can use chewing sticks, that includes neem sticks, mango leaves or miswak sticks. Second mechanical method is most commonly used is the toothbrush. Depending upon the type of bristle, it can be natural or synthetic. Depending upon the diameter of bristle, it can be soft, medium or hard. Depending upon number of tuft present, it can be space tuft or multi-tufted. Depending upon the function, they can be manual toothbrush, power toothbrush, single headed, double headed or the triple headed. Third are the interdental aids, that includes the dental floss, interdental brushes, toothpicks, wooden tips, yarn, perio aid, and gingival stimulation by use of rubber tip stimulator, tongue cleaner. Other methods could be gauze strips or oral irrigation devices. So let us discuss them one by one. The first are the toothbrushing. The objective of toothbrushing is to clean the teeth and interdental space of the food remnants, debris and stains, prevent plaque formation, remove the plaque, stimulate and massage the gingival tissue. Now what are the parts of toothbrush? The toothbrush has head. This one is the head part that holds the bristles. These are the bristles. It is the top portion that you use to clean your teeth. Second is the handle part. The handle, it is the long part of the toothbrush that you hold in your hand while brushing. So it is usually made to be comfortable to the grip. Third are the tuft. A tuft is a small cluster of bristle on the head of toothbrush. Other is the shank portion. The shank is the neck part that connects the head to the handle. So all these are the parts of the toothbrush. The handle can be straight handle or quadrangle handle. It can be either flexible handle. The flexible handle reduce the gum injury by excessive brushing force. Now the toothbrush profile, it can be either concave shaped, convex shaped or multi-level profile. The concave shape with the shorter bristle in the middle of head, that is mainly used to clean the facial tooth surface, whereas the convex shape with the longer bristle in the middle of head appears to be useful for cleaning the lingual surfaces. And the multi-level profiles, they are used when the interproximal efficacy was evaluated. Now these are the parts of toothbrush: shank, tuft, bristles, already discussed. The natural bristle, it is made from hair of hog or wild boar. So hair of hog or wild boar refer to the bristle-like hair that grows on wild boar body. So wild boar, they are type of pigs that are found in various parts of world, and they are known for tough and wiry hair. So this hair is used for making brushes, etc. The artificial filament, it is made from the nylon. Remember, the bristle hardness, it is strictly proportional to square of diameter and inversely proportional to square of the bristle length. So the diameter of bristle, remember this for your MCQ point of view. They can be either ultra soft brush, medium brush, or the hard brush. The diameter, remember the diameter 0.075, 0.2 mm, 0.3 mm and 0.4 mm. Remember this, the diameter for your entrance exam point of view. Now these are the design of the brushes. They can be wavy V shape, bristles, block pattern that are of same length, or crisscross pattern. The bristles designs can be of crisscross that can lift up the plaque very easily. Now this one is important for your entrance exam point of view. According to the ADA, the length of the brushing surface should be 1 to 1.25 long, and the width of brushing surface should be 5 by 16 to 3 by 8 inches wide. Now the rows of bristle should be 2 to 4. So what do you mean by rows of bristle? Suppose this one is a brush, and it refers the rows of bristle refer to the lines or group of bristles that are that appear straight on the brush head. So a toothbrush, it has multiple rows of bristles, usually placed side by side. The tuft per rows, that means that should be 5 to 12, and rows of bristle is 2 to 4. The tuft per rows indicate how many clusters or bunches of bristle there are in each individual row on the brush head. So it's the number of separate group of the bristles you find in the single row. So that amount is 5 to 12. The third is the bristle per tuft. The bristle per tuft refers to the number of individual bristles that make up each of the clusters on the brush head. So that will indicate the density of the bristle within each tuft. So brushes with higher bristle count per tuft might be more effective for cleaning. Now, what should be the frequency and duration of the tooth brushing? The best estimate of actual tooth brushing time seems to be between 30 to 60 seconds, and optimum time is 2 minutes for the plaque removal. The average lifetime of a toothbrush is estimated to be around 2 to 3 months. So you have to change the your toothbrush after every 2 to 3 months, as before the first sign of the filaments become worn. Just change your toothbrush. Brushing force with the powered toothbrush is to be lower than that of manual toothbrush, and the force, that is 1 Newton difference between the manual and power toothbrush. So let us discuss the brushing technique depending upon the motion of the brush during brushing. That is very, very important for your exam point of view. The first is the horizontal technique, that is also known as scrub technique. The horizontal technique is scrub technique. Second, vibratory method, that includes the Bass method or the circular method or Stillman brushing technique or charter brushing technique. So the vibratory method utilize Bass technique, Stillman brushing technique, charter brushing technique. The vertical method involves the modified Bass brushing method, modified Stillman brushing method, Leonard brushing technique, Smith belt brushing technique. The circular method includes the Phones technique. So remember all these for your entrance exam point of view. So these many times questions are asked based upon these techniques. The first is the horizontal tooth brushing. Which one is the technique is the most common used brushing technique? Yes, it is the horizontal brushing technique. So it is the most frequently used by individual who never had instruction in the oral hygiene technique. So here the head of brush, it is positioned perpendicular to tooth surface, and then horizontal back and froth motion is applied. So remember, this technique is known to cause excessive tooth brushing trauma. So which technique can cause maximum tooth brushing abrasion? It is horizontal tooth brushing. So remember this point for your exam point of view. Generally they ask. Second is the vertical brushing. It is also known as Leonard technique. The vertical brushing technique is the Leonard technique. So the bristles of toothbrush, they are placed at 90-degree angle to the facial surface of the teeth. So with the teeth edge to edge, place the filament against the teeth at right angle to the long axis of teeth. So vertical brushing technique, showing the motion upward and downward. So this technique is most convenient and effective for small children with the deciduous teeth. And disadvantages includes the interdental spaces of the permanent teeth of adult, they are not properly cleaned. The next is the circular brushing technique, which one is known as Phones technique. So which technique is indicated in young children? It's the Phones technique. Which technique is given in emotionally handicapped individual? It is the Phones technique. The patient who lack dexterity, it is against the Phone's technique. The child is asked to stretch his arms such that they are parallel to the floor. The child is then asked to make big circle using the whole arm to draw a circle in the air. The circles are reduced in diameter until very small circles they are made in the front of mouth. So this technique is easy to learn, shorter time is required. The disadvantage could be there could be possible trauma to the gingiva. The interdental areas, they are not cleaned properly. The next is the BAF technique, also known as circular technique. So which technique is which technique is also known as circular technique? It is the BAF brushing. Which technique is most widely accepted technique? It's the BAF brushing technique. Which is the most effective technique for removal of the dental plaque? It is the BAF technique. So it is used for the patient with open interproximal areas, cervical areas beneath the height of contour of the enamel and exposed root surfaces. So here the bristles they are placed at 45 degree to the long axis of tooth. They are generally forced into the gingival sulcus and interproximal areas, and they are moved short, back and forth motion. The strokes with vibratory actions for around 20 times, 3 times a day. On the lingual aspect, the brush is inserted vertically and the heel of brush it is pressed into the gingival sulcus. The occlusal surfaces are cleaned by pressing the bristles firmly against the pit and fissure and activating the bristles. It is easy to learn, provide good gingival stimulation and cleans the gingival sulcus. It removes the plaque from interdental areas and cervical areas. So overzealous brushing may convert the very short strokes into scrub brush technique, so that can cause injury to the gingival margin. The other is the vibratory technique. The vibratory technique is the Stillman technique. It is as similar as BAF technique, except the bristles that are placed over the cervical portion of the tooth and partly on the adjacent gingiva. So the brush it is placed at the same manner, that is 45 degree to the long axis of tooth. The brush is activated, short back forth strokes, and it is moved in a coronal traction along the attached gingiva. So it is indicated for spongy gingival tissue, for cleansing area with progressive gingival recession and root exposure. The next is the charter technique or vibratory technique. So which technique is used for individual having open interdental spaces with missing papilla and exposed root surface? It is the charter technique. So which technique is used for patient wearing fixed partial denture or orthodontic appliances? It is the charter technique. So this question was asked in your one of the entrance exam, that a patient wearing partial denture or orthodontic appliance, identify the technique, toothbrushing technique. The preferred toothbrushing technique here is charter method. The patient, those who have periodontal surgery, they are charter technique is indicated in them. Patient with moderate interproximal gingival recession, again charter technique is indicated in them. Similarly, the brush they are placed at 45 degree to the long axis of tooth. The bristles are moved into the interproximal surfaces with slight rotatory and vibratory movement. So this technique has an advantage that plaque is removed gently without much pressure. The other is a roll technique. It is also known as rolling stroke method or ADA method or the sweep method. So this type of method is indicated in children's and adult patient with limited dexterity. So the bristles, they are placed at 45-degree angle apically on the attached gingiva and lightly rolled against the gingiva in a coronal direction to blanch the tissue momentarily. So this technique requires some flexibility around the wrist. So the advantages are provides gingival stimulation. The disadvantages include poor plaque removal from the gingival third of posterior teeth because of the contour of the teeth, poor plaque removal from the sulcus area, and the brushing too high during initial placement can lacerate the alveolar mucosa. So this was the roll technique. Other is the modified pass or Stillman technique. They were designed to concentrate on the cervical portion of the teeth and adjacent gingival tissue. So each of these techniques can be modified to add a roll technique. So the brush is positioned as similar as the pass technique. After activation of brush, head is head in a back and forth direction. The head of brush, it is rolled over gingiva and tooth in occlusal direction, making it possible for the filament to reach the intergingivally. Other is the physiological method or Smith. This method was given by Smith and advocated later by the Bell. So it is based upon principle that toothbrush should follow the physiological pathway that is followed by food and when it travels over the tissues during the mastication. So the advantage is it is a natural self-cleansing mechanism, supragingival cleaning is good, and the interdental space and the sulcus area, they are not cleaned properly. So this was all about the toothbrushing and technique. So this table is very important for your entrance exam point of view. The Fonz technique, the most recommended brushing technique in children is the Fonz technique. Most common brushing technique after periodontal surgeries is charter technique. Most recommended brushing technique for cleaning fixed orthodontic appliance, it is modified charter technique. Most recommended brushing technique in case of gingival recession, it is modified Stillman technique. The most recommended brushing technique for patient with periodontal disease is the circular technique. The most recommended brushing technique for any individual with or without periodontal disease is pass technique. Most common recommended brushing technique is pass or circular technique. Most recommended brushing technique for sulcus cleaning is the modified pass technique. Brushing which causes tooth abrasion, it is the scrub technique. So remember all these for your entrance point of view. Many a times, many questions has been asked in entrance exam related to this. So that is very important for your examination point of view. Other is the super brush. What is super brush? It was designed by Dr. Herman. It is a triple headed manual brush. So there are one head, two head, and here is the third head. So three brush heads, they are combined together. So when placed on chewing surface, all the three surfaces of tooth are cleaned simultaneously. So that will shorten the brushing time. So it is cheaper alternative for use in the case with the disabled individual. Other is the powered toothbrush. They are the electrically powered toothbrush that are designed to mimic back and forth brushing technique. So power brush can give various types of motion like reciprocating, arcuate, orbital, vibratory, elliptical, or doing motion. The speed, the number of strokes per minute, that varies from 1000 cycles for a replaceable battery to about 3600 oscillation per minute. Remember these values for your entrance point of view. What are the ideal characteristics of power toothbrush? It has an active brush tip to facilitate the plaque control and orthodontic head for brushing around and beneath the component of fixed orthodontic appliance. A rotating spiral filament for interproximal cleaning. So it is indicated in children's, handicapped patient, hospitalized patient, patient with ortho appliances, patient those who lack fine motor skills are also recommended with the powered toothbrush. Other is the sonic powered toothbrush. So this type of toothbrush produce high frequency vibrations that can produce phenomenon of cavitation and acoustic microstreaming. So that will help to remove the stain as well as disruption of the bacterial cell wall. That is, they have a bactericidal effect. Other are the electrical active ionic brush. So based upon positive and negative charge. So that based upon the principle of changing surface charge of tooth to repel plaque from the inaccessible area of the teeth. So that is the main principle of the electrically active toothbrushes. Other are the ultrasonic brushes. They have a piezoelectric ultrasonic emitter that is embedded in the brush head. So that is driven by power supply that operates at 1.6 megahertz. So Ambident, it is the first ultrasonic brush. Other are the UV sterilized toothbrush. So those patients who have habit of keeping everything clear and germ free are recommended with ultraviolet sterilized toothbrush system. So they sterilize the toothbrush when it is placed, and it is the most effective household method to sanitize the toothbrush after the contamination. Other are the laser toothbrush, where laser toothbrush are improved version of the modern toothbrush that emit red light in visible spectrum that are powered with the battery. So they help to reduce the dentinal hypersensitivity. So that is the main advantage of these toothbrushes. Other are the chewable toothbrush. So it can be used when there is no water is available. It should not be swallowed and should be disposed of after use of xylitol, flavoring aqua and polydextrose. So they are used as similar as way one would use a chewing gum. Tooth towelettes, they are the most method of plaque removal when the toothbrush is not available. These are the tooth towelettes. So the finger brushes, they are mounted on the index finger of the brushing hand, and they are used to clean the teeth. Other are the foam brushes. They resemble a disposable soft sponge soaked in chlorhexidine on a stick. So they have been dispensed to the hospital patient for intraoral cleaning. So that is why it's their main use. They are used in hospitalized patient. Other are the beam toothbrush. They have a sensor embedded to record and map the brushing behavior. So that data can be saved and analyzed later on. So brush beam, it can collect up to 3 weeks brushing data. So they are helpful in oral health information. Other are the caries detecting toothbrush, that is C-Smart toothbrush, that will able to tell the users whether they have caries developing on teeth or not. So they use a laser technology that collect the reflected light from the caries that is sent to a microcomputer chip in the toothbrush handle. The other are the interdental cleaning aids that includes the dental floss, interdental cleansers like wooden or plastic tips, or the interdental brushes. So these interdental cleaning aids, these are the tools designed to clean the spaces between the teeth that are difficult to treat and reach with the help of regular brushing and flossing. So these tools, they will maintain the proper oral hygiene by removing the food particles, plaque and bacteria from the interdental areas. So these are indicated in the gingival embrasures, teeth with non-alignment, fixed orthoprosthesis with orthodontic appliances, teeth with open furcation area, and after the periodontal therapy. So what are the factors that determine the selection of the interdental aids based upon the type of embrasure? For the type 1 embrasures, where dental floss is advised, here the interdental papilla will fill up the embrasures. The type 2 embrasures, the interdental brushes and wooden tips are recommended. So there is moderate papillary recession in such situations. And for the type 3 embrasures, when there is complete loss of papilla, uni-tufted brushes, they are generally recommended. The dental floss, as we know, it is a thin string that is made up of nylon or Teflon that is used to clean the teeth. So the dental floss, it is most commonly recommended technique Who first of all invented the modern dental floss? It was Levi Sperm Palmley. So remember, for your exam point of view, the Levi Spear Palmley was the person who discovered the dental floss. Various type of dental floss are available that can be waxed, unwaxed, Teflon, thread, flavored, unflavored flosses. Other are the power brush. The power brush, they consist of battery operated and having a nylon tip that slips between the teeth and are very gentle to the gums. So they are effective in patients wearing orthodontic appliances. Example of this is water pick or the power flosser. To facilitate flossing, a special holder may be used. So this is the holder and this one is the floss. Now, what are the techniques that we used for dental flossing? The various two techniques are the spool method and the loop method. So remember, two methods are there. One is the spool. The difference between the spool and the loop method is, in spool method the floss is wound around one finger, while in loop the loop of floss is held between the fingers from both the ends. So in loop, what you have to tie the end of floss together to create a loop, while the spool method does not involve tying. The loop method offers a more secure grip because it is held between the fingers from the both ends. So there was a question in exam, which of following technique is used for dental flossing? The answer was the spool method. So remember the two techniques. Other we can use is wood sticks for cleaning. Other are the interdental brushes. So these are the small brushes with a fine bristle that can be inserted between the teeth to clean the spaces. So they come in various shape and sizes. They consist of soft nylon filament twisted into fine stainless steel wire. Other are the single end tufted brushes. They have a small group of tuft or a single tuft. So they are the filaments, they are directed into the area where the area has to be cleaned, and it is activated with the help of a rotating motion. So these are the interdental brushes that are necessary to clean the interdental space regularly. They are used in the type 2 embrasures. Other is the dental water jet. They uses the stream of water to clean between teeth and along the gum lines. So other are the water pick or a ligator. So the main feature is they include the pulsating and pressure movement. So due to the combination of these two actions, that will cause the disruption of bacterial activity, expulsion of the subgingival bacteria, and removal of the loose debris along with the food particles. Various tongue cleaners are available in the market to clean the tongue. Gauze strip, it is the gauze strip can be inserted adjacent to the edentulous areas, and a facial-lingual shoe-line stroke is used to clean the plaque and the debris. They are indicated in type 3 embrasures, diastema, implant abutments, etc. Other are the rubber tip stimulators. They are recommended for gingival stimulation and plaque removal in open embrasures. Indicated in type 2, type 3 embrasures, or recontour the gingiva following periodontal surgery to increase the epithelial keratinization of the interdental tissue. They are contraindicated in type 1 embrasures. Disclosing agents, they are the material that helps to identify the plaque biofilm. So they are either available in liquid or in tablet form. So these are the various disclosing solution: iodine solution, erythrocin, basic fuchsin, fast green dye that can be used as a disclosing agent. So remember all these. Now there was a question in exam that a patient was given disclosing solution. He stained red film that will indicate newly formed biofilm, and the blue one will indicate the older biofilm that is thicker and more tenacious, that is usually seen just below the gingival margin. So just patient have to just clean these red and blue lines using toothbrush. Now, what are the chemical ways to control plaque? Let us discuss that. So, chemical plaque control has been proven to an ideal adjunct to the mechanical plaque control procedure. So, what are the approaches that cover the chemical plaque control? Number one is the anti-adhesive approach. So this method aims to stop the plaque from sticking to your teeth. So it is just like putting a shield on your teeth to prevent the sticky plaque from clinging or sticking to it. The second is the antimicrobial approach. So this approach uses special substance to fight the tiny germs that make up the plaque. It is like sending soldiers to battle against the bad bacteria on your teeth. Third is the plaque removal. It is about the physically getting rid of plaque by brushing and cleaning your teeth, just like sweeping away dust and dirt from your floor. And last is the anti-pathogenic approach. So this approach will focus on targeting the harmful effect of bacteria in plaque, trying to reduce its ability to cause the damage. It is just like weakening the bad guys so that they can't do much harm. So what are the features of an ideal chemical agent for the plaque control? It should be, number one, it should be safe for oral use. It should be long lasting. It should decrease plaque and gingivitis, prevent pathogenic growth. It should be biocompatible, should not stain teeth. It should have good retentive property. It should be broad spectrum. It should be easy to use, non-staining. It should be affordable with minimum side effect. So these are the ideal requirement of the chemical agents. Now classification of chemical plaque control agents. We can classify them into first generation, second generation, or the third generation. The example of the first generation are the antibiotics, quaternary ammonium compounds, and sanguinolate. And sanguinary. The second generation example is the bisguanides, that is the chlorhexidine. And the third generation example is the delmopinol. So the first generation is the sanguinarine. It is a plant-derived compound that was one of the earliest chemical agents that were used for controlling the dental plaque. So it had antimicrobial properties, and it was incorporated into the oral health products like mouthwash to fight bacteria in the mouth and reduce the plaque buildup. The example of the second generation is the bisgonides. They are the newer generation of chemical agents. Chlorhexidine is one of the example of it. So these agents are effective at reducing the plaque and controlling the bacteria in the mouth. The third generation is the delmopinol. It is another chemical agent that is used for oral hygiene, used as a mouthwash. It helps to prevent the formation of the dental plaque and prevent the biofilm formation and prevent the build of harmful bacteria. Other classification is we can classify them into the anti-plaque enzyme and plaque enzyme. Based on the chemical composition, we can classify them into cationic, anionic, non-ionic, or aryl, or the other combination. So the example of first generation is phenols, essential oils, listerine. So the side effect of them is burning sensation, bitter taste, and staining. So zinc salts, metal salts like zinc, when combined with hexidine triclosan, it shows an additive effect. Zinc assists the inhibition of glycolysis that could limit the plaque formation. So these are the natural products. These are the example of first generation that involves the phenol, propolis. Propolis, it is a natural occurring bee product used by bees to seal openings in their hives. So it contains compound with antibacterial properties that inhibit the plaque control. Fluorides are commonly found in the toothpaste and mouthwash. They strengthen the tooth enamel and helps to prevent the cavities. Antibiotic agents are used to combat the bacteria. So most important side effect is antibiotic resistance bacteria such as methicillin resistant staphylococcus may cause serious or life-threatening infection. Antibiotic like vancomycin, erythromycin, they have been used for the plaque control. Other are the quaternary ammonium compounds like cetylpyridinium chloride. They have been used in mouthwash for their ability to kill bacteria and help to control the. Next, coming to the oxygenation agent. So the oxygenating agent, they are the chemical substances that are used in oral care to improve the oral hygiene, issues like bad breath and bacterial growth. So what are the example of oxygenating agent? The example are hydrogen peroxide. The hydrogen peroxide, it is a common oxygenating agent that is used in mouthwashes and toothpaste. It releases oxygen when it comes in contact with the oral tissue. So that can help to reduce the population of the odor causing bacteria. Other is the chlorine dioxide. It is another oxygenating agent that is used to neutralize the bad breath. it can break down the sulfur compounds in the mouth that are responsible for causing malodor. Other is sodium perborate. This compound releases the oxygen and it is used as a oxygenating agent. Other are the zinc compound that can also function as oxygenating agent and help to neutralize the volatile sulfur compound. Other are the enzymes. What are enzymes? They are the biological molecules that act as an anti-plaque agent. So these enzymes helps to reduce the plaque buildup and support better oral hygiene. The example are papain and bromelain. So papain, it is an enzyme that is derived from papaya fruit. Its ability to break down the proteins helps to remove the protein-based deposits from the teeth and oral tissue. Bromelain, it is an enzyme that is found in the pineapple. So it can also break down protein and it is used in plaque removal. Other are the detergents. The most common detergent that is used in toothpaste is sodium lauryl sulfate. So this detergent exert antimicrobial action by acting on bacterial cell membrane. Other are the second generation chemical plaque control agents. The example is chlorhexidine. So they are known for their bactericidal property. The chlorhexidine is a widely used antimicrobial agent. So it is known for its potent antimicrobial properties. It is commonly found in the form of mouthwashes, gels and other products. So the chlorhexidine, it works by disrupting the bacterial cell membrane that causes death of the bacteria. So it is a broad spectrum. So it is effective against the broad spectrum oral bacteria and helps in plaque formation. So how it acts? It disrupts the outer cell membrane of the bacteria and binds to the bacterial cell surface, causing the leakage of intracellular components and hence leading to the cell death. So this action will prevent the growth as well as the multiplication of the bacteria that will contribute to the plaque formation. So in low concentration, remember, it acts as a bacteriostatic agent. In low concentration, it will act as bacteriostatic, and in high concentration, it is bactericidal. The mode of action is it acts as a bactericidal by causing precipitation of cytoplasm and cell death. So this is how it is bacteriostatic at low concentration and bactericidal at higher concentration. Now, what is the anti-plaque action of the chlorhexidine? Number one, it disrupts the outer cell membrane of bacteria, causing leakage of the intracellular compounds and leading to the cell death. Second, it causes biofilm disruption. It interferes with the formation of biofilm and reducing their ability of bacteria to adhere to the tooth surface and each other. Third, it has an antibacterial spectrum. So it disrupts the biofilm. As we know that bacteria in the mouth, they form communities that known as biofilm that make up the dental plaque. So the chlorhexidine interacts with the formation of these biofilms reducing the ability of the bacteria to adhere to the tooth surface, and hence it disrupts or weakens the structural integrity of biofilm. So that is make it easy to get removed. Third, chlorhexidine has a broad spectrum antibacterial effect. It is effective against wide range of bacteria, including the gram-positive and the gram-negative bacteria. The chlorhexidine, it has ability to adhere to the oral tissue and tooth surface, providing a sustained release of antibacterial action over extended period of time. Other is it reduces the inflammation. By reducing the bacterial load in the mouth, chlorhexidine can reduce the inflammation that is caused by the bacterial activity. It also influences the formation of plaque by precipitating the agglutination factors in the saliva and displacing calcium from the plaque matrix. Now the chlorhexidine, it can be available in the form of mouth rinses. Remember the concentration, it is available in 0.2 to 0.12%. The chlorhexidine, it is used twice daily, which will have substantivity for 12 hours. It is also available in gel form as concentration of 1%, 0.2% and 0.12%. Available in the form of spray as 0.1 and 0.2%. It is also available as formulation of into toothpaste. And varnishes. Chlorhexidine varnishes are used for prophylaxis against the root caries. These are the varnishes and the toothpaste that are available in the market with the name with the chlorhexidine. What is periochip? So periochip, it is a film that contains 2.5 milligram of chlorhexidine gluconate that is incorporated in the biodegradable matrix of gelatin that is cross-linked with glutaraldehyde. So it is a subgingival delivery device. So tooth with probing depth of greater than 5 mm are selected for placement of this periochip. The area of dried and chip, it is inserted into the periodontal pocket with the help of tweezers after thorough scaling and root planing. So the chlorhexidine localized and its sustained release action make it a useful tool in targeting the specific areas of infection and in healing process. So these are the clinical uses of chlorhexidine as a oral hygiene, adjuvant to oral hygiene, post-oral surgery or periodontal surgery. It can be used as a sprays in physically and mentally handicapped patients, medically compromised patients, management of denture stomatitis, recurrent oral ulceration, patients with high caries risk, as a subgingival irrigation, patient using orthodontic treatment, oral malador, and for surgical skin preparation. So all these are the uses of chlorhexidine. While the side effect of chlorhexidine, there could be brown discoloration of teeth, as you can see in this pic. There should be taste perturbation, then the salt taste appears to be preferentially affected. oral mucosal erosions, stenosis of the parotid duct. Rarely hypersensitivity could be the side effect of the chlorhexidine. So the anti-discolorating system, the possibility of eliminating pigmentation and staining that is associated with the chlorhexidine by adding antioxidant like essential oil, peroxyborate. So these antioxidants are added to reduce the discoloration based due to the action of the chlorhexidine. Other is the third generation chemical plaque agents. The example is telmopinol. So telmopinol, how does it works? It works by distributing the formation of dental plaque and inhibiting the attachment of bacteria to the tooth surface. It is a third generation. Other are the Saliflor. So remember the generation. Povidone iodine. It delivers free iodine directly to the bacterial cells and has a broad spectrum of activity against bacteria, fungi, protozoa and viruses. So this povidone iodine, it is available as mouthwash and it is effective in reducing plaque and gingivitis. Probiotics. Probiotics are the biological method of the plaque control that involves the introduction of the beneficial bacteria into the oral cavity to maintain a balance and a healthier microorganisms. So these good bacteria will inhibit the growth of the harmful bacteria and contribute to overall oral health. So probiotics include the lactobacillus species L. salivarius, isolated from the saliva of healthy human volunteer. Other are the dentifrices. So dentifrices is a substance that is used with the toothbrush for purpose of cleaning the accessible surface of the teeth. So it can be available in powder form or gel or in paste forms. Now what is the composition of toothpaste? It contains, very important, asked many a times in your exam, it contains abrasive. The abrasive are calcium carbonate, alumina, silica. So these have an abrasive action that aids in eliminating the plaque and removing stain from the tooth surface. What are the binding agents? Water soluble agents like alginate, sodium carboxymethyl cellulose. These are the binding agents that controls the consistency of the toothpaste. Third, detergents. Detergents are incorporated. The material used is sodium lauryl sulfate. So this produces a foam which aids in removal of food debris. Other are the humectants. Includes sorbitol, glycerin, polyethylene glycerols. So that aids in reducing loss of moisture from the toothpaste. Flavoring agents includes the peppermint oil, spearmint oil. They give a pleasant flavor, a fresh taste in the mouth after the use. Sweetener and coloring agent includes saccharin, that is a sweetener. Antibacterial agents are the eclosan, delmopinol, metallic salts, etc. Anti-calculus agents. Some toothpaste contain anti-calculus agents. Example is pyrophosphate, zinc citrate, gantrous acid. So they inhibit the mineralization of the plaque. Anti-caries agents. Some toothpaste contains anti-carious agents like sodium monofluorophosphate, sodium fluoride, stannous fluoride. Desensitizing agents includes the sodium fluoride, potassium nitrate, and the strontium chloride. So remember the component of the toothpaste. Many a times, many MCQ they have been asked in your entrance exam based upon this. Now, what are the factors that will affect the dentifrice? Abrasiveness, amount of dentifrice used, toothbrush type, toothbrushing method, toothbrushing frequency and duration. The intraoral factors are salivary, consistency, xerostomia, etc. So these are the factors that affect the dentifrice abrasiveness. Now, various types of dentifrices have been used. Anti-cavity dentifrices that contain fluoride to stop the enamel decalcification, promote remineralization. Fluorides have been added containing sodium fluoride, stannous fluoride. Calcium phosphate will increase the concentration of these ions in the oral cavity. Sodium bicarbonate increases the pH in saliva and creates an unsuitable environment for the growth of acid uric bacteria. So anti-calculus, anti-tartar paste are available in the market. They prevent the mineralization of the plaque. Desensitizing toothpaste are available in market. So what are the ways by which desensitizing dentifrices can work? Number one, by preventing the transmission of neural signals and hence preventing the pain, or by blocking the dentinal tubules. So these are the various desensitizing agents: potassium nitrate, oxalate, fluoride, sodium citrate, strontium chloride. So these all are the desensitizing agent. You can get a question, the desensitizing agent in the toothpaste is, so your answer will be likely that. Various toothpaste that contains anti-plaque agent that will reduce the plaque growth, including triclosan, papain and sanguinol extract. Triclosan. So various type of the tooth whitening paste are there available in the market containing hydrogen peroxide for the teeth bleaching. The peroxide will deliver the oxygen radical to the enamel. According to ADA, because it acts as a bleaching agent, hydrogen peroxide, it changes the color of enamel by cleaning the extrinsic stains that discolor outside of the tooth. So which paste, what are the ingredients that causes the tooth whitening? It's the hydrogen peroxide. Some paste contains enhanced flavoring agents that helps to fight against halitosis, like aloe vera, leaf juice and essential oils of the peppermint. Toothpaste for the children's, they have a low concentration of fluoride containing 500 to 1000 ppm to prevent the cases of fluorosis. Along with that, they have pleasant flavors and comes in attractive colors. Some natural or herbal dentifrices, they are available. They don't contain dyes, artificial flavors or chemicals. They are purely organic. Some paste contains hydroxyapatite crystals as an alternative to fluoride for remineralization and repair of the teeth. The enamelone, it is formulated with stannous fluoride and amorphous calcium phosphate technology. So they contains the key ingredients that contribute to the enamel protection. So here there is a remineralization process that is enhanced by converting soluble calcium and phosphate to naturally hydroxyapatite. So enamelone contains just 970 ppm of fluoride. So desensitizing dentifrices like Novamine, the active ingredient is calcium sodium phosphosilicate. The saliva reacts with the calcium sodium phosphosilicate to form a protective layer of hydroxyapatite on the teeth. That layer creates a barrier that prevents the tooth sensitivity. Tooth mouse, it is not a dentifrice but a topical tooth cream. So it contains amorphous calcium phosphate, a compound that can help remineralize the tooth enamel. So it provides calcium and phosphate ions that can help repair and strengthen the weakened areas of the enamel. Other is the Clean Pro paste. It contains combination of fluoride, calcium and phosphate that are components found naturally in the saliva.